Mayor Frank Gonzalez. And I don't know if Tim is on as well, but Tim Chapa and Frank Gonzalez from the city of Sanger. Thank you so much for joining us, Mayor, and making time for us.
Oh, it's my pleasure to be here and contribute to the overall testing of the entire county and state and actually the nation. So I'm very glad to be here.
We are so glad that you joined us as well because we wanted to make this announcement together. So we've hinted at this in the last couple of days, but the state of California has granted a testing site asset, and through collaborating with the city of Sanger, we're going to be able to offer testing in the same model that we have here at Fresno City College in the city of Sanger itself. Can you tell us more about where it's going to be and how that's going, Mayor Gonzalez?
Well, yeah, you know what? We were looking at different places in the city of Sanger. We ultimately, the best place to put this is a place that everybody knows in the city, for one. It's kind of a central place in the city of Sanger. It'll be at the Sanger Community Center. And you know what? We all of our Parks and Rec events are pretty much on hold right now, canceled. So therein lies an empty building for us to utilize for different things. And this is probably one of the best things that out of all this mess, helping out the community and opening up a testing facility there for not only the citizens of Sanger, which I'm happy about. They don't have to travel very far.
Yes.
Just up the street for them. But also the region, all the rural communities. There's a lot of like Orange Cove and nearby towns like unincorporated ones like Del Rey. There's Reedley and Dinuba. They could all come to the city of Sanger.
Yes, sir, and we really appreciate it. The registration to get tested will be available online. It will actually be the same website that we offer for the Fresno City College site, and that's actually already on our website. If you look under the testing sites, and people can just get an account and register online, and then just pick a date and a time. Be prepared to do that on Monday. That's when our start date is for when people can actually get registered. And in the meantime, we're working very hard with the mayor's team and with the city of Sanger to make sure that all of our ducks are in a row, and that we'll be ready to swab up to 130 people per day in the city of Sanger to offer free testing for whoever needs it, whether they have symptoms or if they don't have symptoms. They can just get up there and get it done. And I imagine there's plenty of parking available as well, right, Mayor Gonzalez?
Yes, sir. That was one of the main reasons we chose that place, because you know what? There's parking all the way around that facility. We're basically ready to go, and I can't tell you how happy I am to be working with the county, the state, and even at the federal level. Bringing this testing facility to little old town, the city of Sanger is actually pretty exciting for us.
It's super important. Like you said, we really want to serve our rural communities, and really we hope that this is something that the whole county can take advantage of. We will certainly be sending people to get tested there as soon as that site is ready, and we're so glad that Sanger is part of the solution as we all come together for this pandemic response. So thank you very much. We really appreciate you joining us, and we appreciate all of your support throughout this project.
Thank you. Like they always say, we're all in this together. So we're very happy to help.
Does anyone have any questions for Mayor Gonzalez at this time, or any questions for our team about this site? I think there was a question that we got emailed about the number of tests. And like I said, the state really wants 132 tests done every day. That's how many the team is capable of doing at these sites. In terms of what's happening at Fresno City College, on our first day, we did 60. On our second day, we did 100. We're still waiting to hear about our third day, which is today. But we're rapidly ramping up to do dozens and up to 130 tests per day, just as people get registered for it. We also have a phone number that you can call, and we will display that prominently on our website. So if you don't have access to the web registration, don't let that be a barrier. you can just go ahead and call our number at 600-3332 and request registration for the testing sites. Or there's a 1-800 number that the vendor called OptumServe is also offering to do direct registration through them. So we will definitely get you registered regardless of if you have an online account or not. But the easiest way to do it is by creating your own online account. And that will not only get you registered, but it will also be a good mechanism for them to contact you with your test results as well. So thank you very much, Mayor Gonzalez.
All right.
Any questions for the mayor while we have him on our call?
Hey, I have a quick question. This is Kirsten with KC24 and CBS 47. Just the question for the mayor. Can you talk a little bit about how the city of Sanger is doing as far as the COVID cases and kind of what challenges you guys are facing being a little bit more rural than other cities? Obviously, testing is a big one, I imagine.
Yeah, that's one of the bigger ones is the testing part. Yes. Another thing is just getting the word out there and having the people realize that this is a real emergency. And I noticed that our numbers in Sanger were going up quite a bit. I told everybody just nobody needs to panic. Just be sure to take care of yourself, take care of your loved ones. Make sure you do the things that have been talked about from the POTUS all the way down to me, the city mayor. If you're sick, stay home. Please wash your hands. All of the social distancing things. But just trying to get that message out there as best I can. I use every medium I can do. Social media. Our utility mail-in thing. All of the information is on there. Our website. We put flyers around town, and just word of mouth. And I tell everybody, you know what? If you know somebody doesn't have access to an email or even just a phone, just go over there and let them know, what's going on. Because, like I said, everybody's in this together. Thank you.
Great question. I just want to echo exactly what the mayor said. We really are all in this together. This is requiring a lot of learning for the medical professionals, but also for our civic leaders like the mayor, and also for the general public. So we're all learning and teaching each other together about best practices and about the best ways to get good medical information out to people who need it. So we always appreciate whenever civic leaders are willing to work with us. And that actually leads to the next point that we're not done collaborating with the city of Sanger. We want every one of our cities to really help us do another important phase in getting ready to get into the next phase of recovery, which is with the contact tracing. And so what we'd really like is for all of our civic leaders and really all of our organizations to learn about contact tracing and to really help us do best practices with the way that gets done. So we'll be speaking with the mayor's team and really with all of the different cities all around our county about contact tracing because we understand that along with testing, that's going to be another important pillar on the roadmap that we need to have established. And that will include some online courses that people will need to take to learn exactly what that is, as well as some real world exercises and really best practices that we will all figure out about how to get contact tracing done. Every community is different. As you said, Kelsey, that some of the rural communities have different challenges compared to some of the urban communities. Employers have different challenges than households. Schools are different from hospitals. But all of us have different vulnerabilities when it comes to COVID-19. And all of us need to understand what our own individual vulnerabilities may be wherever we work. And that's going to require a lot of dialogue related to this. So lots more to come, lots more to teach each other. But hopefully we can all work together to keep our community safe and to protect ourselves as we tiptoe into the next phases and get more and more sectors opened up.
Dr. Vohra, this is Tad Weber with the B. I just wanted to double check if I heard correctly. So the state wants a minimum of 130 tests a day. Is that for the whole county or is that per test site? How does that work?
Yes, sir. This is actually national guidance. It's not really a requirement. It's just best practices. But epidemiologists have really set forth a standard that you know for every 1,000 people in your population, you should have 152 tests being done. For every 100,000 people in your population, which in our county equates to about 1,500 tests that we need to do every single day here in the county of Fresno. We are inching towards that goal. We're not at goal yet, but again, news like what the mayor is sharing is just fantastic because it just means that we are that much closer to our goal of 1,500 by adding these 132 tests every day. That will go into our overall daily goal. And we feel like we're getting there just by adding more and more capacity like this. So we will continue to do that. Another bottleneck that we've really been able to overcome is the test kits. And so the CDC as well as UCSF have really been able to send our community lots and lots of test kits, like on the order of thousands. We've got about 5,000 that were sent to us by the CDC. I see Brandy Nikaido from UCSF Fresno is here. And she was able to share along with her team that UCSF main campus was able to deploy another 5,000 tests to be used at the UCSF Fresno Medical Center and community regional medical centers. So again, just great news when it comes to testing because we are helping to meet the challenges and overcome some of the bottlenecks that we were experiencing as recently as last week. And we really hope that hopefully in a week or two, we will be at that goal of 1,500 tests per day, which will really position us to meet the needs of surveillance, testing, and just making sure that our communities stay as safe as possible. Thanks, Tad. Any other questions for Mayor Gonzalez or about testing in general?
Can you guys hear me?
Yes.
Hi, sorry, kind of new to the press conference in Fresno. My name is Angela Hart. I'm a reporter with Kaiser Health News.
Great.
I'll talk here because I'm looking at a screen over here. I wanted to ask the Mayor Gonzalez, I wanted to ask you a question. I wanted to ask also maybe the health officer or the mayor, whoever wants to jump in. Just two questions about some of the more vulnerable communities. We're hearing that there's some challenges getting the word out to maybe some people who don't have insurance or low-income populations about getting testing. Are you guys having that challenge here? I guess that's the first one. Do you want me to do the other one now or do you want me to wait?
Either way, that's a great question. It's something that we are definitely focusing on. We're trying to reach really the diversity of the communities that we have in Fresno County. We know that we have people that may not speak English, so we're really trying to do some Spanish language and even Hmong and Punjabi language messaging related to COVID best practices, prevention, what people can do if they do come down with symptoms. And we've been doing that for many weeks. We know that it's time to change our messaging a little bit just because things are changing at the state level and maybe at the local level with how things are slowly opening up. And so we know that we need to get more messaging out there just to craft messages that are responsive to this current time. Beyond that, the question that you asked about insurance is a great one. That's really a universal concern that people have is, how can they afford to get this testing done, especially in this time of great economic hardship. And I think that whenever people hear the best information that's available, that's actually reassuring because the test that we're offering through the city of Sanger and also the Fresno City College is totally free, and all of the services that we offer through the Department of Public Health in terms of follow-up and contact tracing are also coming without charge to the individual patient. And beyond that, we're happy to help troubleshoot any other challenges in terms of economic hardships that people may be having for the rest of their medical care. And that's just something that has to be done on a case-by-case basis.
But you're saying that is a challenge, though?
Out there. Oh, do
You're
I?
saying that is a challenge, though. That is a challenge, though. You're saying, even though
yeah.
the testing is free, getting the word out to people who don't know that.
Yes, we've heard that some people don't understand that the testing, should not cost anything. If you have insurance, your insurance should cover it. If you don't have insurance, don't let that be a barrier. And so, every opportunity that we get to explain that to people, we're taking advantage of that. And we're trying to be sensitive to all of the different populations that we serve.
And then Mayor Gonzalez, the other vulnerable, I just wonder, well, it doesn't have to be you specifically, but another vulnerable population is homeless people. And I'm not really that familiar with how much of a problem that is in your community, but I wonder if there is concern as the state slowly reopens, is there concern that these infections are going to grow in those homeless communities? And I don't know if the state could help out a little bit more. What do you guys need?
Well, you know what, on your first question, that is going to be, getting the message out there, because that's what I hear a lot of times is some of the citizens that, they don't want to go to the doctor. They don't want to get a test because they can't afford it. So, getting that word out there and making sure that they understand, hey, this is going to be free for y'all. So just come and get your test done. The other thing that we're doing with the county, and with the county, I can't express how much gratitude I have for them, because they have been reaching out to the city of Sanger on a daily basis and going out and screening homeless people to find out, hey, do you feel good? Are you have a fever? If not, this is where we're going to take you to get a test. And that working along, hand in hand with the county has been kind of a godsend, because you know what, in the city of Sanger, the homeless population isn't that, one person homeless is bad, but it hasn't reached like the hundreds of people or anything like that. We're still pretty low, but with that said, the county has been coming out and doing just follow-ups with homeless people, just to make sure that they know that, hey, they have somebody on their side and looking out for them.
Yeah, and we've deployed shelter accommodations. I feel like this pandemic, the silver lining has been how much has been done to help homeless populations throughout the county. And Dewan Utek, who's our director of behavioral health, I don't know if she's on today. She sometimes joins our calls. Has been instrumental in spearheading so many of the initiatives related to really bolstering all of the services that the homeless populations are able to receive. We've been able to set up iPads that have telemedicine connections to one of our primary care clinic systems, so that each one of our homeless accommodations and shelters that have been set up have that remote telemedicine connection as soon as somebody has any symptoms at all, whether they're related to COVID or something else. We're also planning out surveillance testing in our homeless shelters and populations. That's something that we're still working through the logistics of, and making sure that we have really everyone's questions answered before we embark on that. But that is something that we think is a priority, just to make sure that those congregate settings, just like our other congregate settings, like our nursing homes and our jails, et cetera, really all of these congregate settings are vulnerable populations. And so we want to pay extra attention to them to make sure that they have really as proactive of an approach as we can provide. And thirdly, like the mayor said, we're really focusing on screening people every single day, even outside of the testing, to make sure that we catch people that have symptoms and make sure that they have everything they need to isolate or quarantine, so that their infection doesn't get spread. All right, thank you so much. Once again, thank you to Mayor Gonzalez. I really appreciate you joining us, and look forward to coming out. I'm actually scheduled to come out tomorrow and see the site myself, along with Dave Palmaville, and we really do appreciate your whole team's support. This is moving so quickly. I think we just started talking about this around this time last week, and here we are, ready to make this announcement for our community. So I couldn't be happier with how fast and how collaborative your team has been. Thank you so much.
And thank you. Yes, have a good one.
Great, thank you. Okay, our next guest.